Hello everyone, welcome back to my channel. I'm Ishita Sharma, a dental student. And if you are in your BDS first year watching this video thinking anatomy is too much, I don't even know where to start. Trust me, I have been there. So, like in the beginning, anatomy doesn't feel like a subject, it feels like a whole language. Nerves, ganglions, foramina, relations. So, like everything is mixed together. So, in this video, I'll tell you exactly like what to study from like which book, what actually matters for exams, how to study short notes and flashcards. These are the flashcards which I made in my first year. How to relate structures instead of like mugging, and like how to actually master anatomy without burning out. So yes, I'll also share my flashcard short notes PDF if you want it later. So in this video, I'm not going to motivate you, unlike my all previous videos. So in this video, I'm going to tell you how to survive and actually score in anatomy, the way seniors should tell juniors. Okay, like for the books, guys, don't overthink this. Like your BD Chaurasia is the main book. Treat it like your Bible. Is your like exam book. Love it or hate it. That's what examiners check in your answer sheet. But here's where like people go wrong. They try to understand anatomy only from BDC. BDC is not like for understanding. It's for confirmation, for clarity, for like learning everything. BDC is the book you need to like study from. Although there are reference books as well, like Grey's Anatomy. That's really a good book, but we dental students don't have much of time to only study anatomy. So if you have any confusion about a certain topic, or if you feel like you want to understand it more better, you can go for like Grey's Anatomy. And Vishram Singh is also a book which is also good. I have studied some like chapters from that book as well to understand the things. See, I used to study from this book only, so I used to mark everything which was important, visualize things, make a clear idea in your mind, make clear pictures of like what structure is related to what, all the nerves, blood vessels, everything. So, like, now I'm gonna tell you how I used to study from like BDC in my first year. I first tried to see the structures, diagrams, atlas, videos, etc. Then I opened BDC and only read the headings, subheadings, nerve names, clinical correlations. I ignored the extra lines like I knew I wouldn't remember. For that time only, I ignored that lines, although I did study them. But yeah, for remembering, I just only went through the like headings. Then I closed the book and tried to like recall the flow. See, if I couldn't recall it, I didn't panic. I just repeated the cycle. Okay, so this is like very important. Although you should have a thorough reading of whole your BDC book, that's really important. And one more thing, let me save you from a common mistake. Like rewriting anatomy notes is the like mostly a waste of time. You don't need beautiful notes. You need revisable notes for quick revision and all. So I made very short notes, flashcards, and like one nerve, one page, like what is the course of nerve. Like here I made for facial nerve, then like all the important ganglions, and this flow charts, like what is the course of nerve. So I used to make these flashcards for quick revision. That helped me a lot for quick revisions. For example, if I tell you about like facial nerve, so this is the like diagram which I used to make. I used to write origin, course, branches, and applied. That's it. That's the most important thing which you need to write in your exams. So like if I needed detail, I went back to BDC. So I used to study in detail, but I can't remember everything. But I should never like afford to forget important main things. So I used to make it on these type of flashcards. So I used to revise it again. And you know what? Like what I used to do is like if there are extraocular muscles, orbit, teeth, hard palate, soft palate, I used to write everything: nerve supply, blood supply, we like all the lymph nodes, vagera, etc. So I used to write it on a piece of page, everything. Because see, you can't just go through whole of your book your BDC book one night before your exams. You need time. So, and you don't have that much time. So, you should always make short notes. These are lifesavers. If you go through that, you're like, everything is done. Trust me, these are lifesavers. So, I was panicking a lot before my anatomy exam, but I had these short notes, flashcards, so I only revised from them. If you guys want my like flashcards, PDF, and all, I'll share it. Like, comment down PDF, I'll share it to you guys. For the exams, please listen. In exams, like, no one expects perfection. They expect proper headings, a diagram, neat presentation, and basic accuracy. Like, even if you don't remember everything, don't leave the answer blank. Write something like which is related to, underline nerve names, and the most important part, draw diagrams. Even if it's ugly, don't like afford to skip diagrams. That's the main thing which helps you remember and which fetches you marks. So it's very important. And trust me, anatomy was so easy for me. I used to love it. And for the book, see, Head and Neck, volume 3, Head and Neck. This is the most important book. You can't afford to skip at least a page of it. This is very important. So you need to have your basics very clear. And for brain neuroanatomy, you should know all the nerves, all the cranial nerves basically, and applied of it. Okay, for this volume 1, this is also important. Thorax part is very important. Although upper limb, we guys don't have to go in detail about the limbs, or although it's okay if you leave the limbs, it's not very important. See, thorax, it's very important. And specimen, lungs, heart, these also comes in spotting as well as in your vivas. So that's very important. So you need to study this one as well. And about this volume 2, lower limb, abdomen, and pelvis. See, again, lower limb is not very important. You just need to know about the bones name and little bit about it, not in detail as such. And for abdomen, you need to study all the organs. That's very important. That do comes in your theory exam as well as in your practical in spotting, vivas, etc. So this is also like you need to go through it. This is also important. And about these histology and embryology, see, you just need to know the embryology, not in very detail, but you should read it once. And histology also, like histology also comes in spotting, also it can come in your exams. So this is also important. If you want to get distinction, then you can't afford to miss histology and embryology. If you only want to pass, then don't like spend so much time on these, because these take so much time. But like, that's not very worth it to spend so much time. But yeah, this your third volume, Head and Neck, this is very important. You need to know it everything. If you need to pass, if you study your head and neck, you can pass. Believe me, you can pass. Yes, if anatomy makes you feel like slow or stupid, you are not alone. This subject is heavy. It humbles everyone. Some people like understand early, some understands later, some just learn how to write answers well. So all three at the end passes. If you are in your first year and feeling overwhelmed, breathe. Guys, breathe. If this video helped you even a little, like, share, and subscribe. If you want my short anatomy flashcard notes, PDF, comment PDF, or DM me on Instagram, I'll share with you guys. And remember, anatomy is not about memorizing everything, it's about understanding enough to explain it calmly in exams. And if you want more such videos for physiology, biochemistry, dental anatomy, and histology, I'm gonna make it for you guys. I try to make everything which is very important. And you know what? I'll see you in my next one. Don't forget to brush your teeth and stay blushed. Bye bye.